Good day, everyone. On behalf of Moja Ramesh Amitis Health Tourism Company, I'm here with you to introduce to you briefly another bariatric surgery or weight loss surgery that we can offer to foreign patients and medical tourists in Iran. Today's topic is gastric bypass surgery, or commonly also known as Roux-en-Y. Gastric bypass is a surgery that helps you lose weight by changing the way your stomach and small intestine handle the food you eat. After this surgery, your stomach will be smaller and you will feel fuller faster with less amount of food than you normally have. After this surgery, the food will not travel through some parts of your stomach and small intestine, so your body will not get all of the calories that you can get from the food you eat, hence you lose weight over time. You may be a candidate for this surgery if you are very obese and if exercise and diet have not worked out for you to lose weight. There are some factors that are taken into account to see if you're a candidate, such as health conditions such as type 2 diabetes or hypertension, and also your BMI or body mass index that doctors monitor to see if you're qualified for this surgery. One thing you need to consider that bypass surgery is not a quick fix for weight loss, and after this surgery you need to for the rest of your life you will need to adhere to a healthier lifestyle, healthier diet and regular exercise to maximize the result of your weight loss. People whose BMI are more than 40 and are considered excessively obese are good candidates for this surgery, or if you have a BMI of 35 or more and you're suffering from serious health conditions such as type 2 diabetes, heart problems, lung problems, etc. As with any other surgery, there are risks that are associated with this surgery. There are risks for the surgery, such as having allergic reaction to the medicine and anesthesia, lung problems and bleeding, blood clots, etc. And there are risks with that may happen after this surgery as a result of this surgery, that is gastritis or inflamed stomach lining or heartburn or stomach ulcers and vomiting if you take more amounts of food than your stomach pouch can handle, or there is a syndrome called dumping syndrome, which leads to nausea, vomiting, lightheadedness, etc. And there might even happen scarring inside your stomach that may in the future lead to blockage of your bowels. Another risk associated is injury to other internal organs during the surgery. You will need to take these risks and discuss them with your doctor before going for this surgery. Now, before the procedure, from weeks before, your surgeon and your doctor will monitor your overall health and medical history, such as a complete physical exam, a an ultrasound of your gallbladder and its health, the medications you take or the supplements you take, and your medical history to see if you are currently suffering from health conditions such as heart problems, lung problems, or blood pressure, etc. These are all need to be considered before this surgery. You may also need to go through nutritional counseling and mental counseling, because you need to be emotionally ready for this surgery and for the lifestyle that you're going to adhere for the rest of your life after the surgery. And if you're a smoker, you need to quit smoking several weeks before the surgery, and even after that, quit it for life, as smoking can affect the recovery and the result of your endeavor actually. About a week before the surgery, your surgeon will instruct you to go easy on the medications you currently take, or to refrain from taking blood thinning medications such as aspirin or ibuprofen, etc. And on the day of the surgery, you will be instructed to stop eating or drinking to be ready for this surgery. What will happen during the surgery? The surgery takes place in two steps. First of all, you will go under general anesthesia, which means you will be asleep for the whole duration of the surgery, which takes about 2 to 4 hours. In the first step, your surgeon will use staples to divide your stomach into two parts, a smaller one and a larger one. The smaller one will be called the pouch that the food will go through, and the larger one will be blocked and actually bypassed. And then in the next step, the surgeon will attach a part of your small intestine to a small hole in that little pouch, which is the route that the food will travel through from the moment you eat. In this surgery, your stomach will become as small as a walnut that can contain only an ounce of food, which is about 28 grams. The surgery can be done open or laparoscopically, which is more common these days. In the open surgery, a large cut is done on your stomach, and in the laparoscopic surgery, there will be a few small incisions made on your upper abdomen, and the scope and the instruments that are needed for the surgery are inserted in your body through these small incisions. A camera is attached and inserted into your stomach via a catheter and a flexible tube, and the doctor will perform the surgery watching a video monitor of what is going on inside your stomach. After the surgery, you will need to stay at the hospital for 1 to 4 days. And as I said, it takes about 2 to 4 hours. While at the hospital, for the first 1 to 3 days, you will not be permitted to take food, and there will be catheters attached to you to remove the urine and the fluids from your intestine, and your health will be monitored by the hospital staff. Pain medications will be administered to you. and etc. You will be able to leave the hospital if you can move around without pain medications, and that's about it. After the 3 days, you can start a diet with liquid, and then going to puree and soft food, and then regular food that you can have for the rest of your life. Via this surgery, you will be able to lose weight about 4.5 to 9 kilograms a month for the first year. That is, if you adhere to the healthy diet and the instructions that the surgeon has given you. And in the next and as time goes by, the rate of weight loss will decrease. And after 2 years, you will be able to lose 1/2 or even more weight, lose 1/2 or more of your extra weight in the first 2 years. As I said, this surgery will completely lose your lifestyle, and it needs your commitment and your mental preparation to go through this surgery, or else it might not work out for you by not losing weight or even gaining weight, and other complications that may even require a second revision surgery. That's about it about this surgery. And one thing to consider is that via this surgery, underlying health conditions can be resolved, such as asthma, gastroesophageal reflux syndrome, type 2 diabetes, obstructive sleep apnea, high blood pressure, and high cholesterol even. So that's about it about this surgery. And what we offer to you in Iran is that we offer 3 packages that all offer the same standard and quality of medical services, that start from $2,680, which does not include accommodation, but all other medical services, transfer, translator and interpretation, etc. And the second package, it includes a 7-night stay in a 3-star hotel. And the third package, which will be about $3,000 with 7 nights of stay in a 5-star hotel. I hope this information has been helpful for you, and if you have any questions or concerns regarding this surgery, or if you need any consultation, please contact us via our social media channels, from WhatsApp to website of amethystmedtour.com, our Instagram and Facebook, and we will get back to you ASAP. And remember that we will be with you the whole journey, from before until the follow-up sessions after you have left this country too. Thank you for your time, and have a good time and day.